And World Pride is not just a celebration of gay rights, it's also a chance to educate, and that's what Toronto health officials are doing about cancer. Live to Natalie Duddridge with the campaign encouraging more people in the LGBTQ community to get screened for the deadly disease. Natalie.
Well, Roger, the Canadian Cancer Society says the rate of people getting tested in communities like this one here in the Village is just simply too low. And so they say they're using the buzz around World Pride to help get that message out that getting screened does save lives.
When I was 5 years old, my mother passed away of colon cancer.
I had a hero I worked for. He came to me crying.
It's stories like these that the Canadian Cancer Society is getting members of the lesbian, gay, bisexual, transvestite and queer communities to share, with hopes more people will get screened and more lives will be saved.
Bumps and different bumps in my breast.
People look at me and they think, well, the name is Shoshana, female name. They think someone's a guy standing up. So, like it's to me, it's a bit stressful. And, it's not just myself, for other trans folk.
Shoshana says she used to think twice before going to a doctor because of her privacy concerns, something so many identify with. Recent studies show cancer screening rates are too low in the LGBTQ community.
LGBTQ communities as a whole are much less likely to access preventative care, and that's often because of either fear of or actual homophobia and transphobia with their healthcare providers.
Canadian health data shows that bisexual women were less likely to have had a mammogram than heterosexual women, and lesbians have lower rates of pap test screening than straight women.
It's a little daunting to see posters of yourself around town.
Dave Arnold has literally become the poster boy for the Get Screened campaign. He himself is an HIV-positive rectal cancer survivor. His mom died of breast cancer and his dad died of prostate cancer.
It was really scary. Everybody was dying. It was before there was a drug cocktail. I was told I had 3 to 5 years to live.
That was 25 years ago. Now, because of the campaign, Dave says he gets approached by people too shy to talk to their doctors.
It's because they're scared. They're feeling that fear, that lack of understanding and knowledge.
That's why the Canadian Cancer Society says they're pumping more money into awareness campaigns, hoping to break the stigma not only for patients, but also the medical community.
Don't wait until you have a serious problem before you find a good doctor. Have a good doctor, have a good rapport with them, and then that makes all of this easier to say, can you do a rectal exam?
We know that it can be difficult to go to the doctor, and we're saying, we know it's uncomfortable and it can save your life, so you've got to do it.
Now, if you have any concerns, the Canadian Cancer Society says they'll have a number of booths set up here during Pride Week in the Village to answer any of your questions, but they are encouraging people that if you think you have any symptoms of the disease, they want you to contact your doctor right away. I'm live here in the Village. Back to you in the newsroom.